Okay, what I'm going to do now is show a rhombic flap. I'm going to do it very close to here because we're seeing what the limits of this model are. So let's just cut out the circular defect here. Usual technique. Okay, let's get that out of the way. And this is 23 millimeters wide for some reason. And this excision is not quite accurate. Okay, let's get that out of the way. Whoa, a little ding there, but that's working too fast. Right, and then with our rhombic flap design, we've got the 23 mils or so. We're going to take a straight line off the center of that defect, about the same diameter usually, 23 mils, and we're then going to come off that at 60 degrees here with the same length. So let's see, 20, we haven't quite got to 23, so we need to enlarge it a bit. Okay, there we go. And I think I've come through so I'm going to be careful picking this up as you would in real life. Yep. Okay, and then this is basically like a single lobe transposition flap. Similar to the banner flap that will be up here and just going like that. This is stepped back a bit and is going to go into there. So this line is going to meet this line, and this tip is going to go down here. That tip's going to go over there, like this. That's going to bunch up here. So that is going to create a standing cone or something redundancy that needs to come out here. So we can take that out in the beginning, or we can take it out as a Burroughs triangle afterwards, which gives you some control over what size it is and exactly where you position it. But you can see it's not coming into the flat pedicle there, but it could do if you moved it this way. So you've got to be a little bit careful about how you position it. So here we can use the hook, or I quite like the hook so we don't traumatize the flap. So let's pick it up. Let's get a nice layer of fat. That's going to mimic the defect depth. This is actually a bit, I've done it a bit deeper there, but anyway, never mind. So it might stand up in real life. We want to match it if possible. So, and then we're going to need to undermine all the way around so that it moves and so that it goes into that defect and the scar stabilizes between the flap and all the surroundings so that it doesn't trapdoor. So I'm going to go all the way around. This is quite a nice undermining model. Of course, you're not going to have a freshly produced island pedicle flap right next door in your average patient. Otherwise, it's a pretty bad day for them. Probably not recommended for healing to be doing multiple flaps nearby. But this is not a real patient. So we're going to undermine all the way back to that pivot point of the flap, right back here. Doing this obviously faster than I probably would in real life because I want to get it done for the video, but I am doing it around the right sort of places and the right extent that I would do in real life. But you may need to do obviously some hemostasis as you go. So then we should find that this is going to move a lot more easily, and it is going to go into that area. So that looks good, but this basically you've got to make sure that's going to move to there. And you can see in the model it's pulling up the edge quite a bit. So we probably would want to ideally position it in the middle of the model. But it's giving quite an interesting approximation of what happens in real life. Not dissimilar at all, depending on your design and where it is and the tightness of the skin, etc. So let's get another stitch. And this is, again, a non-absorbable stitch, which I'm just using for visualization purposes. So really, I mean, again, you can put you can put this in the position that you want to make sure it's going to go there, or you can stitch the secondary defect, the donor area first, to make sure that that's going to close and to take the tension off. And you can stitch it in a number of ways, but I'm going to stitch it down this end first to try and maximize the tension reduction. So I'm going to put a very dermal stitch in here. And I'm going to try not to crimp the edge too much as I'm doing it. You could use the skin hook. You could use an assistant. It's quite helpful in this one because there, as you can see, is something in the way. So we want to be able to tie our knot but not crimp our flap. So ideally somebody holds that out the way for you. But anyway, let's just tie it off. So that's going to ping out immediately. So I'm going to use this tension reduction technique and bring that right across. And when it's even so springy it's not quite working, let's go for that. Yeah, that's good. And then I'm going to do one more. There's a lot of wastage on this stitch, never mind. Okay, so that just doing it quickly to try and demonstrate the principle. So it's obviously, and this is another reason to wear gloves in surgery, isn't it? So you don't get covered in skin marker. Not that we ever think of operating without gloves these days. But yeah, so there we've closed that secondary defect and got rid of the tension on that side, and that goes together fine. So although it's a sort of square peg in a round hole, as it's sometimes called, you can pretty much see how it's going to go in. It's going to go across like that. We're probably going to amputate a tiny little bit of that tip to make it sit down nicely. It's going to go in there. And then we've got this bulge where we expected, or on that side. And you can see that it's actually wanting to bulge up there. But if I take that out there, that is going to cut directly into the flat pedicle. So we don't really want to do that ideally. So we're going to displace it a little bit to the side. So either over here or even just there. Take that out. And then we can see how that's going to sew into there and into there very nicely. So I don't really need to do the dog ear yet, but I'm just going to make sure that this all it's going to go where I want it. So the main tension is sort of here. So I want to make sure that's going to go where I want. So I might do that first, or I might do this one first where it sort of holds, it's going to hold it in position. So let's do that one first. That's going to hold it in position better for us to do all the remaining stitches. Except I've used one that I've already chopped. So that hasn't worked very well. Right, let's go back to that. Try again. And you can tell I've used it already because it's so wiggly. Anyway, let's go and see if we can tie this off. Pretty good. All right. Let's get that down. Right, now we can see, just doing that very quickly just to get it in position, but you can see we've got reasonable eversion there. Spend more time on it in real life. And then we can see how the positioning is going to work, and we're going to put another one here. And let's just get on with that instead of talking about it. Let's put another one here. Let's get that in the fat. So we've kind of got an extra layer of kind of redness here, which we don't really need, but the feel is very accurate. It's a bit like a superficial layer of muscle, but doesn't match reality. But it feels very good. Let's bring that down there. Now I think I've not achieved closure there, you see, because I've took that chunk out of the epidermis with my cavalier attitude to the new initial cutting of the flap, doing it quickly. Then I do not have perfect wound apposition there, but I've got the deeper layers together, and then I would have to sew that a little bit tighter with the surface stitch to get it together, and that's probably acceptable, but a little careless. We wouldn't do that with a human. So then we got in position here, and we can see this is still bunching up. So we're going to decide where we want to take that out. Probably we'll take it out here, but in any case, we're going to probably put another sort of stitch in around about here. So we might as well sort of have a go at that. Instrument springing open because it's single-use one that's being used multiple times. I haven't grabbed enough dermis there, so I'm going to grab a little bit more. Oh, too much. Okay. And then I'm getting short here, so I'm going to start grabbing the needle with the forceps instead of my fingers, which is good practice anyway, because I'm running out of stitch. See if I can lock that in position. Yep, and then take one more. Oop. I'm shredding the stitch here with these needle holders and my casual attitude. Right, yeah, so there we've got another buried stitch in position. If we stick the skin hook in, we can see, I'll just check the cameras on the, yeah, see what I'm doing. Yep, so you can see that I've got that. And actually that's, once we've stitched it, you can see it's coming out exactly where I'd drawn it, where I'd anticipated we would want it to be. So initially it looked a bit more vertical. So if you take it out too soon, you could end up cutting into your flap by mistake. So here we've got right to the end and it's in position. And this is looking a bit floppy, so we'd take that tip off. That's overlapping, we don't need that. We just use the skin hook to pop that out. Again here, this is overlapping, so, and in real life I would make this just slightly smaller than the defect so that it's under a little bit of tension, but not much. And then obviously I'm not going to prod it with my knife in real life, but I am going to pull it with the, what would I do? I might push it with some scissors, or I might push it with some Adsons, and then get it something like that. And then I use a lot of buried stitches, so I'd probably put another one in, small one, maybe a 5/0 in the tip here. Maybe not, because it's not under any tension once you've fiddled with it. Actually, maybe not. And then, but you do want it to be nicely everted, nicely stabilized. And then we're going to take this dog ear out. And remember, we do that by getting the skin hook in the middle, imagining where it's going to be. And wherever you cut is going to be where it's going to end up, because you're going to cut and then you're going to cut to match. Here I've drawn it anyway, so you could go with the purple outline. But you can see, if I pull it to this side, it wants to go there. I'm not cutting right into the flap. Okay, I'm going to cut it through there to the point that I wanted. And then I'm going to grab it with the skin hook, overlap it, and then cut to match. And this feels very realistic, actually. Okay, try and do one cut, not many cuts. Okay, so that's pretty good. Now, I think I've pulled it up, I've stretched it a little bit too much as I was doing it, and it's maybe taken slightly too much out. It's about right. And then I'd put another buried stitch in there to make sure that's nicely everted. And then we make sure that this is nicely aligned. You can see it's sort of flopping up, so I'd put another buried stitch in there. Get that nicely pinned down. Maybe another one in there. And then just run round with the running stitch. So I think that works really nicely, actually.